Hi, friends. Rebecca Barnes, publisher of Prince William Living Magazine, and we are here today with Nicholas Dugan, MD, from Novant Health UVA Health Systems Prince William Surgical Services. He has a fellowship training in advanced minimally invasive, which is laparoscopic surgery, and specializes in reflux, hiatal hernia, and bariatric surgery. We've asked him to come today to discuss weight loss, bariatric surgery, what the options are, and what we need to know to see if it's right for you as an individual. So, Dr. Dugan, welcome to Prince William Living. Thanks for joining us.
Thanks for having me.
So tell us just a little bit, what made you want to pursue bariatric surgery? What do you like most about it? Really, what called you to it?
Well, bariatric surgery is it's a great surgical field because you're able to, with one surgery, essentially help patients with many medical problems at one time. So not just maybe their weight or the way they look and feel, but also a lot of their underlying health problems like high blood pressure, diabetes, high cholesterol, et cetera. So it's very rewarding in that you're able to help so many medical problems with one surgery.
Now, I know there's several different types. It's evolved over the years. Tell us a little bit about what type of bariatric surgery you offer at Novant Health UVA Health Systems, and a little bit about the benefits of the surgery.
So we offer primarily two bariatric surgeries: the gastric bypass, which is one of the older bariatric surgeries, was invented in the 1960s. It's been modified since that time, obviously, but it's been proven to be successful and safe, and so it's still performed today. And then we also perform the sleeve gastrectomy, which is the most popular bariatric surgery currently in the United States. It's one of the newer surgeries. It's been around for about 20 years now. Both are very safe and both are very efficacious for weight loss.
Okay, so one of the things about this surgery is how to identify being a good candidate. But we talked a little earlier, I want to touch on how people feel about weight and some of the stigma that comes along with that, and what you look for a good candidate for this surgery.
So you're right, there is a stigma about weight. Some people are embarrassed about their weight, and some people may shame others for pursuing bariatric surgery because they look at it as a quick way out, or cheating, or maybe not putting in the work and able to achieve what other people try to achieve, which is diet and exercise. And the truth of the matter is, the bariatric surgery journey is not a quick one, and it's a lifelong journey. There is no quick fix to losing weight. The surgery is a good way to jumpstart weight loss and help maintain weight loss long term, but it only works in conjunction with dedication to changing your quality of your lifestyle, and sticking with the diet and exercise plan. We typically look for patients who have tried and failed non-surgical intervention, such as diet and exercise, in the past, and are still struggling with significant obesity. We use something called the BMI, which is a body mass index, which allows us to compare one person of one height to another person of a different height and their weights. It gives us a way to do that. And in order to qualify for the surgery, you have to have a BMI of at least 35 and have a comorbidity, such as like diabetes, high blood pressure, or have a BMI greater than 40 without a comorbidity. So those are patients who they're significantly overweight to the point where the risks of the surgery are outweighed by the benefits of the surgery.
All right, tell us a little bit, when someone's looking at this surgery, what does the timeline look like from A to Z?
So from the time we see a patient in the office, it's a minimum of about 2 months before we could even get a surgery scheduled. There's a lot of preoperative workup that happens. We have a wide set of labs that we order, including vitamins, to make sure that there aren't deficiencies before surgery. We do an upper endoscopy, which is kind of like a colonoscopy, except for we're looking inside your stomach and your esophagus to make sure there aren't any abnormalities there that might affect our decision-making for which procedure to perform. everyone has to get cleared by a psychologist or a psychiatrist. And we also have them meet with our dietitian, who will help kind of make some changes before surgery so that the transition to the way you need to eat after is smoother. And then we'll also go over our special pre-op diet and our post-op diet that is about 6 weeks long. And that's if your insurance company doesn't require any mandated medical weight program. Some insurance companies have specific timeframes that they make you engage in a medically supervised weight loss program for before you can have surgery. So for instance, Medicaid is 6 months, and you have to meet with a bariatrician who's like a primary care doctor that focuses on weight loss every single month for 6 months in a row before you can even qualify to be scheduled for surgery. Others are 3 months, and rarely we see some that are 12 months, but the majority are between 3 and 6 months.
Okay. Well, when you've had the surgery, what is the recovery time? What does that look like?
So our average patient takes about 2 weeks off of work, just so they can focus on themselves for the 2 weeks while they're getting used to their new kind of way of eating and drinking. And they're able to stay focused on staying hydrated, because that's one of the biggest risk factors after surgery is dehydration. Because you're not able to just, drink a big glass of water at the end of the day to catch up. You kind of have to drink throughout the day. If you have a desk job or something that maybe you do from home right now, especially in pandemic times, some people are returning to work sooner, just doing some work at their desk, and they're able to drink kind of throughout the day. If you're a construction worker or you're doing something where there's a lot of manual labor, maybe you're outside a lot and you don't have access to water throughout the day, then you may need a little bit longer. As far as pain goes, most people are feeling pretty much back to normal after a few days from a pain perspective. It's more that staying hydrated and kind of trying out different foods and different beverages and figuring out what tastes good, what does their stomach agree with, that is kind of the recovery that they have to go through.
So let's say that someone like myself wants to lose weight, but I don't do well with surgery, and I've had several surgeries in the last few years, and maybe I'm apprehensive on having another one. What other things could I do, or someone else that's in the same situation do in terms of losing weight? What kind of programs do you have available to those that maybe don't want to get surgery?
So for patients who don't qualify for surgery because they're either not heavy enough or they don't have a comorbidity, or they just aren't interested in surgery because they don't want to have the time off of work or they're risk averse, we do offer what we call a medical weight loss program. So it's a comprehensive program where we have you see our dietitian. She'll go through kind of what you eat. We tell people to food journal beforehand for a few days, because that kind of helps the dietitian get a better idea of exactly what you're eating. It also helps you get a better idea, because sometimes you don't really recall everything that you're eating or don't realize what exactly you're eating and drinking. And then we also send you to, again, the bariatrician who would do our preoperative programs, also do our non-surgical weight loss programs, where essentially there's a new variety of medications that they can offer that have been pretty successful with weight loss, that have been developed in the last decade or so, and that have been proven safe so far. So there are other options, and people do have some success with it.
Excellent. So they always call it the freshman 15. I feel like we have the COVID 20.
Mm-hmm.
There's a lot of people out there now that we're kind of emerging, and we're all looking at each other going, yeah, because we've put on a couple of pounds in this pandemic. What advice do you have? What things can we do to keep a healthy weight, to kind of improve our health, and maybe refocus ourselves now that we're kind of emerging and realizing that perhaps we've put on a couple pounds too many?
So I think one of the most important steps is to make a kind of a mental decision that you want a certain goal, and to set a specific goal. If you don't set a goal, it's sometimes hard to reach it because you don't know how well you're doing at it. So setting goals, maybe you want to lose 2 pounds a week, maybe you want to be fit into a certain dress or other article of clothing by a wedding or a certain period of time. And then set time for yourself. And, it's just, people have kids, people have stressful jobs. And one of the things that I hear people talk about is that they just don't have time to go to the gym. They don't have time to cook for themselves. So they often find themselves eating on the go or ordering out because it's easier. And if you sit down and make time for yourself, just focus on budgeting your time, 30 minutes to an hour, 4 to 5 times a week, and use that time to either exercise, look up new recipes and meal plan for the week, and really plan ahead. You'll find yourself not stuck into situations where you're, it's dinner time and you don't know what to get, or you're on the go and you just have to grab, fast food or order out or something like that. So making a cognizant effort and setting the time aside to do so.
No, that's great advice. I always say that if you don't have time to take care of yourselves, then you don't have time to be sick, because you'd be surprised what a huge time investment it is when you're ill. So it's better to spend that time making sure that you're doing everything you can not to get sick.
Absolutely.
So we thank you for joining us today. We're going to have all this information below in the video, as well as in the post, so that people can get in touch with Novant Health UVA Health Systems to find out more about what they can do to live a healthy lifestyle, possibly look at this surgery and find out what options are right for them. We thank you for joining us today, Dr. Dugan.
No, thank you for having me.
Okay. Take care. Thanks, everyone.